Hi, this is Dr. Joydeep Chaudhary with Academics in Nutshell. The topic is some riddles that's associated with rabies. The rabies exposure is categorized into 1, 2, and 3 by WHO depending on the type of contact or bite. So, touching or feeding of animals, licks on intact skin is considered no exposure and no treatment is required other than skin care. Category 2 is nibbling of uncovered skin, minor scratches, abrasions without bleeding, and also licks on broken skin. This is exposure, and here vaccine should be given immediately along with care of the wound and skin. Category 3 are the transdermal bites and scratches where there is bleeding and also contamination of the mucous membrane. This is severe exposure where rabies immunoglobulin or monoclonal antibody and vaccine should be given. But we have to remember, if it's an exposure to wild animal, then the category 2 bite should be treated as category 3. And in immunocompromised also, the category 2 bites should be treated as category 3 with immunoglobulin or monoclonal antibody. There are certain norms of wound management. Definitely it has to be washed as soon as possible with running tap water. With soap may be applied, but definitely the wound should not be touched with bare hand, or any irritant should never be applied because the damage to the skin may facilitate entry of the rabies virus. Most of the warm-blooded animals transmit rabies, but there are some possible exceptions, like the domestic rat, squirrel, guinea pig, or rabbit. But whenever there is doubt, it's better to treat than to take a chance. Man-to-man transmission is rare except cornea transplant, and human bite, well, theoretically possible, but no case has been reported. Milk of a rabid animal consumption, there is no reported case of rabies. Milk usually doesn't transmit rabies virus, and of course if it's boiled, the virus is inactivated. Among the various anti-rabies vaccine, the tissue culture vaccine is the newer one, which is all are equally effective, immunogenic and safe. Anyone can be used, and WHO has recommended tissue culture vaccine only for use. The confusion about provoked and unprovoked bites, but the management doesn't differ, because provocation should not be considered a definite that the animal is not rabid. And it's very difficult to understand what a dog considers provocation. Sometimes people are bitten by a vaccinated pet dog. It has been seen that up to 29% of dogs do not seroconvert even after regular vaccination. So pet vaccination is never reliable, and immediate post-exposure prophylaxis should be started. Observation of the pet dog for 10 days may be considered, but that's also quite variable. If a person has received completed pre-exposure prophylaxis and the person often gets scratches and bites, within 3 months, no need for revaccination. Beyond 3 months, 2 vaccine doses at 0 and 3 months. But it differs if the person is high risk, then yearly antibody test should be done, and booster if the antibody levels fall below 0.5 IU. Booster is recommended every 5 years for people at less risk, especially if antibody testing is not available. Pre-exposure prophylaxis in children. Well, WHO has recommended that in canine rabies endemic country like India, the focus should be on at-risk group of children. But again, who are the at-risk group? Pet dog in the house, even if immunized, pet dog at neighbor's house, even if immunized, community pets, stray dogs in the neighborhood. So that covers all. See you again. Thank you for watching.